Hey guys, welcome back, and today we are going to discuss about other nursing diagnosis and care plan, dysfunctional family process. So what is dysfunctional family process? That we'll check first. The nursing diagnosis of dysfunctional family process can be defined as an alteration in family functioning due to factors related to family system. In healthcare, this will observe in working with families facing medical and psychological issues. Healthcare providers should understand the basic components of family functioning. Healthcare professionals needs to understand the basic components of family functioning. Now we'll see the Nanda nursing diagnosis. According to Nanda International or Nanda I, the definition of dysfunctional family process is an alteration in family system associated with family conflict, marital problems, okay, then other problems that interfere with the ability of the families to function. So, what kind of subjective data we can observe in this condition means feeling of anger, guilt, fear, shame, hopelessness, helplessness within the family system. And what you can observe or objective data includes negative communication styles and lack of structure, consistency, and role definitions. Dysfunctional family process or dysfunctional family functions can lead to mental health concerns, substance abuse issues, social adjustment problems, poor academic performance, eating disorders, early pregnancy, increased risk of physical injuries or behavioral and emotional problems. So dysfunctional family process can lead to these type of problems. Now we'll see the nursing diagnosis. Okay, we cannot specifically say this is the nursing diagnosis. So depend upon the condition of your patient, you have to pick the nursing diagnosis and you have to formulate the nursing diagnosis. So I'll give you some list. Okay, dysfunctional family process related to poor communication or lack of emotional support or unresolved conflicts or substance abuse or mental illness or financial stress or abuse or neglect. That you have to find out from the case sheet or from the patient or from the family, as evidenced by frequent argument or tension within the family members, or emotional withdrawal or isolation of one or more family member, inconsistent or inappropriate parenting behavior, or breakdown in family roles and responsibilities, or evidence of domestic violence or verbal abuse, or poor coping mechanisms in handling stress or crisis, or deterioration in family relationships or bonding. So it can write like dysfunctional family process related to substance abuse as evidenced by frequent arguments, emotional withdrawal, and neglects of family responsibilities. Or you can write like dysfunctional family process related to poor communication as evidenced by emotional withdrawal or isolation of one or more family members. So depend upon the condition of your patient's situation, you have to create the nursing diagnosis. Now we'll see the nursing care plan. So as I said in previous videos, while writing your nursing care plan, you have to write all the columns: assessment, diagnosis, planning, rational, implementation, and evaluation. Okay. So this many columns you have to write. I didn't add evaluation in this slide. So in future next slides, you can see evaluation column. So first is assessment. Under assessment, what you have to write? You have to write subjective data and objective data. Subjective data means what patient says about their condition or what is their complaints, and objective data means what you have observed from the patient situation. So what is the subjective data here? The patient complains that he or she feel unsupported and fighting always with the family members. Then objective data, the patient shows withdrawal or lack of eye contact between family members during the assessments, and there is evidence of substance abuse. Now we'll see the diagnosis. So I have taken this diagnosis for this nursing care plan. So you have to take the diagnosis depend upon the condition. So here the nursing diagnosis: dysfunctional family process related to substance abuse as evidenced by frequent arguments, emotional withdrawal, and neglect of family responsibilities. Then one more thing you have to add in that column. What is that goal? The patient will improve family communication and function so the members can support one another and resolve conflicts effectively. The patient will improve family communication. That is the goal. Now we'll see the planning, rational, and implementation. So the first planning always history collection and physical examination collection. Do history collection and physical examination, and this is a mental health condition. So problems are there in the emotional status. So you can write even mental status examination. So do history collection and mental status examination for what? To understand the condition. Implementation, done history collection and mental status examination. Do your planning in present tense. Do your rational with the letter to. Okay, start with to. Then implementation in past tense. Okay, do history collection and physical examination or mental status examination. Rational to understand the condition. Implementation done history collection and mental status examination, and you can write the result also in the implementation. Next, planning assess how the family is structured. Rational to understand the family functions and roles. Implementation assessed how roles are distributed in between the parent child, or for example parent child roles and breadwinner role. Next, planning evaluate how family members communicate each other. To know the communication of the patient with the family, evaluated especially during time of stress or conflict. Next, planning identify available resources, external services which patient and family is using to overcome the stress. To know what type of support system they are using, identify the resources like counseling, support groups. Next, planning observation for or observe for signs of emotional withdrawal, anger, guilt, or frustration. To understand the coping strategies of the patient, observed signs of emotional withdrawal, anger, guilt, or frustration. Next, encourage the family members to express their feelings. To identify the root cause of the problem, encourage the family members to express their feeling and given enough time. Next, educate about effective communication techniques to patient and family. For what? To make them to understand the importance of active listening. Educated the importance of communication and active listening. Next, offer information about healthy family dynamics and coping mechanism. To improve the coping mechanism, offered and taught them the conflict resolution techniques such as negotiation and compromise. Next, help the family identify problems they are facing to facilitate the problem solving process. Okay, help and role play difficult conversation and situations or practice conflicts solution. Then refer the family to family therapy or counseling to address the deeper issues or trauma. Referred and suggested the individual therapy. Encourage the use of extended family or friends as additional support system to strengthen the support system. Encourage the use of talking to all family members, including the distant family and other resource group. Next, encourage the individual family members to engage in self-care activities to overcome and manage stress. Encourage to do exercise, hobbies, medication, etc. And what is the evaluation? The patient improved family communication and function and reported fewer arguments, better listening skills, and more frequent discussion to resolve conflicts. Like that, you have to write your nursing care plan for dysfunctional family process. So planning will be more because it's not a problem to body, it's a problem to the mind of patient. So you have to give more time, you have to plan accordingly, and you have to develop the nursing diagnosis depend upon the condition of your patient. And these planning you can use for all these planning, rational, and implementation you can use for all nursing diagnosis. I mean all dysfunctional family process nursing diagnosis. Hope you understand, guys. Thank you. Next time, next nursing diagnosis and care plan. Thank you, guys. Bye.